Hi, everyone, and thank you so much for joining today. Our program today is produced by Friends of Winship, and Friends of Winship's mission is to build community understanding and awareness about Winship while raising funds to support its research and patient care programs. If you've participated in any way in the fashion show fundraiser in the past 3 years, you are a member of Friends, so welcome to the program. Before we get started, I'd like to remind everyone of a few housekeeping items. Although we are in webinar mode, please do keep your microphone on mute just in case. This program is being recorded and it'll be shared with all of our registrants and our members. If you have any questions during the program, please use the Q&A button at the bottom of your screen. And lastly, if you have any technical difficulties, you can always dial in to listen to the program. Today's program is led by Anna Bausum, ND, the Integrative Oncology Specialist at Winship Cancer Institute. Dr. Bausum is joined by Almira Catic, an MPH and Associate Director of Programs at Winship. I'd like to welcome Dr. Bausum and Almira to get us started by sharing their inspiration for the field of integrative oncology and their desire to work for Winship.
I'll get us started. I'm Dr. Anna Bausum. I'm the Integrative Oncology Specialist. If that is a new term for anyone tuning in today, it's because this is a brand new role in a brand new department. So I got interested in integrative oncology early, even pre-medical school. All my work experiences and other little breadcrumbs along the way, I was asking, do we talk to patients about X, Y, Z, supplement use, diet, lifestyle, mindfulness, stress reduction techniques alongside their standard of care therapies, or even in the survivorship space? And the answer was consistently no. We don't know, or we don't talk about it because we're just not set up for these types of conversations in the traditional cancer care model as it stands right now. So I'm here in this new role to start to bring subject matter expertise and kind of like unveil a new way of helping treat people as a whole person all along the cancer care continuum. So it's good to be here today.
Hi, my name is Almira Catic. I am the Associate Director of Programs for Integrative Oncology and Survivorship. One of the reasons why I was really interested in joining this program is because before I joined Integrative Oncology, I was in research, and often I saw patients who have had very severe illnesses and side effects associated with those illnesses, which they just accepted as part of their new normal, which didn't really sit well with me. And when we started the conversation of adding something in addition to their traditional treatments where we can support patients from the moment that they're diagnosed all the way throughout their lives, and really, stray away from this idea that cancer patients are meant to feel bad after treatment. Like, we're here to support those patients. We're here to return them to their normal and not have them just accept this new normal of feeling bad. So when this opportunity came along, I really jumped on it, and I'm excited to be here and really support our patients throughout their not only cancer journey, but really throughout their life. So today we're just going to tell you a little bit about what integrative oncology is. And I'm going to go ahead and jump right into that. Could I have the next slide, please? All right, so the biggest, I think, misconception about integrative oncology is that often patients think that it's an alternative treatment rather than a complementary treatment. So we always want to approach this from a perspective that this is not a instead of or in place of conventional medicine treatment. This is a together or alongside conventional treatment. What we really want to do is not replace any current treatment that patients are being offered, but support patients throughout their journey. And as they're experiencing some of these side effects that normally come with cancer treatment and post-cancer treatment, we're here to support them with evidence-based and personalized and safe therapies that can really where they can feel empowered to take their own healthcare into their own hands and just feel better. So the biggest thing that I want to focus on, that this is not an instead of medicine, but it's alongside medicine. Next slide, please. So what we did before we started this program is we really wanted to understand, how many patients are using integrative medicine and what's out there kind of in the community. So we did a review of cancer patient use of natural therapies. It's a CDC review, and we found that 50% of patients use some kind of natural therapy after diagnosis. And we think that this is likely underreported because sometimes doctors don't know what patients use, whether it's a supplement, form of exercise, some kind of meditation session, yoga, all of these things really are used pretty widely. We also found out that 66% of oncologists say that they avoid the topic because of the lack of training. And this is really a missed opportunity, and where we felt that we could make a huge impact. Next slide, please. We also did a review of 45 NCI designated comprehensive cancer centers and found that some of the most common integrative medicine therapies mentioned are acupuncture and meditation. And most common therapies offered in the healthcare systems are things like acupuncture, massage therapy, consultations about nutrition, dietary supplements, and herbs. So this is really where we kind of channeled our start when we began the program. Next slide, please. So one thing that we really wanted to do is not only use what's out in the community, but we wanted to understand the Winship cancer patient population. And we did an internal needs assessment, and we looked at Winship disease group leaders, and we talked to them and asked them, what do you want to see as part of an integrative oncology program? And most of them said that there needs to be personnel to support the overabundance of patients that we have. We need to educate our providers, and we need to embed this program into the existing care model. And finally, it needs to be accessible and cost effective. They also talked about some of the therapies that they want to see, which included the top 3, which were already we already knew that, but it was good confirmation to hear it from our providers as well, including acupuncture, massage therapy, education, nutrition, and others. Next slide, please. And we also asked our patients. We interviewed 200 patients that are 100 active treatment and 100 survivors. And over 60% of patients reported familiarity with integrative oncology approaches. And the greatest interests were in massage, acupuncture, wellness, and exercise and nutrition. Next slide, please. So we do have some cancer support services before we started this program already, but they're really in silos, and we felt like we needed to bring it all together. I just wanted to kind of have a list here. And then we shifted the focused area to bring it all together. Next slide, please. So what are our current program initiatives? So we're doing oncology group acutherapy clinic at Emory Midtown. We have an integrative oncology specialist, Dr. Bausum, who does patient consultations. We are collaborating with our care team with an emphasis on this multidisciplinary approach. And we're looking at cost-effective ways and efficient ways of delivering care by providing shared medical appointments, which are education appointments for our patients, and it allows us to see more patients at the same time. Next slide, please. I just wanted to share a little slide about our team. It started off with just Dr. Viraj Master and myself. Dr. Master is the director of the program. And then we added Anna and kind of grew from there. Right now we have 2 acupuncturists, and we have some supporting staff, including a research associate, patient care coordinator, and the student intern. And we're also looking to grow this group as well. Next slide, please. Okay, I'm going to turn it over to Dr. Bausum. She's going to talk a little bit about acupuncture.
All right. So for anyone who isn't familiar with acupuncture already, these next slides will help you provide a little bit of context. Next slide. The acupuncture comes from traditional Chinese medicine and has evidence to support a few different Symptoms, side effects, specifically important for cancer patients. Lots of our group acutherapy patients present right now with either cancer-related pain or cancer treatment-related pain. So whether it's cancer from it being spread to muscles and skeletal pain, or things like peripheral neuropathy from a cancer treatment and those longstanding side effects, we really see that both evidence and our patient population thus far holds true. People really experience meaningful benefit with the use of acupuncture. Next slide, please. So there's the needles going in, that's the treatments we're doing in the group setting, but there's also a big emphasis in those appointments, either the group setting or even the education I do in one-on-one consults, at leaving patients feeling empowered to actively participate in their care with the use of acupressure massage at home too. This is data that comes from a group out of the University of Michigan saying that 10 points a day, 10 minutes total, gives meaningful relief to both active treatment patients and survivors for cancer-related fatigue with the use of acupressure massage. Next slide, please. This is a little bit of the setup we have. We see 4 patients an hour in 15-minute segments in this group care delivery model. And you say, why groups? It keeps the costs low per patient, makes it easier for us to share the love, given that we only have very limited support in terms of kind of our team. So the acupuncturist sees multiple in the same time block with the staggered appointments, and it really helps us do this one-to-many and see as many patients as we can. Next slide, please. In terms of seeing as many patients as we can, we launched this group acupuncture or acutherapy clinic in December, first beta testing it on available staff and other service providers just to see if we get our flow down, and welcomed our first scheduled patients to this appointment starting early February. And really we're pacing seeing anywhere from 60 plus to up to 80 patients a month, depending on if we kind of have a 5th week in that month. This clinic right now only runs on Mondays because that's kind of our staffing limitations present state, but we're really seeing good results, high patient volume, enthusiasm, and meaningful clinical improvements in how people are presenting. Next slide, please. So, acupuncture is helpful or evidence-informed for a whole list of symptom side effects related to cancer or cancer-related treatments, both for active patients receiving treatments or longstanding survivors. And here is kind of a little baseline of how we welcome patients. We say, how can we help you today? And in their own words, they give us that input. Next slide, please. We did a little bit of an assessment from our early sessions already in these last months, and we see that truly, based on that feedback we're getting from patients, over a series of a few treatments, people are seeing a persistent improvement in the cumulative nature of the presenting symptoms, right? So often people aren't just coming in for pain or for neuropathy or for stress. They list 3 to 5 things. And we're seeing that over the course of 6 sessions, 95% of patients are seeing improvements at that 6th session versus about 75th reporting saying, oh, the first session did a little something. Next slide, please. In addition to the improvement over time, we're seeing the effect of the duration and benefit really improve as well. After that first treatment, we see that 32% of patients were saying that the benefit from one acupuncture treatment was lasting greater than a week. Scale that to after 6 treatments, patients were saying 75% of our patient population was saying that their improvement was lasting duration of greater than a week. Next slide, please. Here's a little bit of feedback preliminarily when we trialed the beta testing with our staff and other clinic providers. And it's really a beautiful opportunity, lived experience here, and seeing these hardworking nurses, doctors, MAs all show up at maybe considering when we have our staffing a little bit more grown in our department, scaled, to offer some employee wellness and really help your providers show up better for you and other patients with group acupuncture as well. Next slide, please. These next 3 slides are just some general patient feedback. To summarize, this is a head and neck cancer patient who saw us over 6 months after his radiation and surgery. He was in a wheelchair from delayed wound healing to his feet. He had radiation-related changes that left him unable to really speak well or move his neck. He was relatively dependent on his wife for activities of daily living and self-care. After his 12th acupuncture treatment, he no longer is in a wheelchair. He's walking in, talking, telling us he never felt better in the last 6 months. His family, when he talks to them in Pakistan, can understand him clearly, and he's returning to being able to eat a greater variety in terms of spices to the palate. So really, he's more himself than he has in the last year. Next slide, please. This is a gyn-onc patient, a long-term survivor too. Her chemotherapy regimen left her with peripheral neuropathy and unable to drive herself to the store and really meaningfully move around the house during the day. She now, combination of consults and directed supplement use, as well as lifestyle changes and acupuncture, no longer is on her gabapentin. And for anyone who's unfamiliar with gabapentin, it's a medicine that is prescribed for peripheral neuropathy. Sometimes works, sometimes doesn't work well, but it has significant side effects such as dizziness, drowsiness, that even if it helps with the peripheral neuropathy, it leaves many people kind of debilitated in different ways. Next slide, please. Last patient testimonial here. This is a young woman who has triple negative breast cancer that she's been actively receiving treatment for in over the course of the last 2 years. And she says that acupuncture is one of the few things that provide her meaningful, pain-free moments in between kind of this marathon she's on in battling the breast cancer. So it's a profound privilege to be able to help grow this department, participate, and see these success stories from our patients already this early on after just, 8 months or so of running a one day a week clinic. Next slide, please. So a little bit about the work I do as an integrative oncology specialist. Next slide, please. This is a patient-centered conversation where I plug and play with different evidence-informed tools to use alongside your treatments, your survivorship care plans, and really helps achieve everyone's goals, the patient's, the clinician's, mine, helping people live better with a diagnosis, treatment, or their survivorship, and do so with some discretion applied to supplement use, or really counseling which supplements you must avoid to avoid interactions with heavy medicines, food as medicine or food first approach with diet, and other complementary or integrative therapies. Next slide, please. This is an evolving field. It's exciting that this is kind of an area of medicine more and more clinical organizations are publishing guidelines around. So this is ASCO's clinical guidelines for breast cancer support using integrative medicine. And I think here there's a beautiful opportunity for us at Winship to, given the unique geographical position Winship and Emory holds, the patient base it draws, and the types of diverse diseases and diverse patients we see, to really actively and in a positive way contribute to the clinical evidence to continue to support the growth of this field. Next slide, please. Okay, integrative oncology. So this is a little bit of data. We see this data come out of Israel. We see that patients who are receiving integrative oncology care have a greater adherence and satisfaction, meaning that you are happier going through your treatments, but also able to get more of the cancer-directed therapies through the secondary or rather primary prevention of cancer treatment-related side effects. So a real-life example being there are medicines in the chemotherapy regimens that cause pain, nausea, vomiting, peripheral neuropathy, etc. Sometimes those become so severe that you're actually left to have a delay or a dose reduction, meaning that you're either pushing out your chemo to the right or receiving less chemo meant to fight the cancer than if we could have supported you as kind of a whole person, prevented those treatment-related side effects, and gotten you more of the medicine we know works at fighting the cancer actively. Next slide, please. So here, a little bit of the numbers. It's just me and Almira. We're the full-time army of two in integrative oncology. So the numbers fluctuate a little bit depending on what else was requiring my attention. But between kind of 2 days of telemedicine appointments and some in-person presence in the breast cancer clinic and our head and neck program, these are kind of the volumes where on a good month, I'm able to consult kind of 40 minimum right now. Given that there's a lot of operational pieces that I'm accounting for too that take away from my ability to do patient care right now. Next slide, please. All right, Almira, I'll punt it back to you.
Sorry, had a moment there. Great. So we're also going to talk about something that's kind of a new and innovative way that we're approaching patient care. Next slide, please. It's shared medical appointments. What shared medical appointments are groups of patients meeting over time for integrative oncology care. This is really designed to optimize care, efficiency, improve disease outcomes, increase patients' engagement, and really drive down the cost of care. So essentially, to kind of break it down, what happens now is that our providers don't have 20 minutes to sit down and talk to every single patient and discuss their, to educate the patients. They're really focused on the disease. They're focused on, treating the patients and treating their disease. But sometimes patients have a ton of questions, and for each provider to spend an additional 20 or 30 or 40 minutes talking to a patient, it's a lot. So we've come up with a creative way of educating a lot of patients at the same time. This screenshot here is one of our virtual shared medical appointments, which we had in March, where we spend an hour or so providing education materials for patients. And then there's also a one-on-one session with a provider. So for instance, while Dr. Bausum might be educating patients, Dr. Diller or Dr. Master, another one of our providers, will spend about 10 to 15 minutes personalizing whatever the care plan is for that patient. And then if the patient needs more, then we can set them up with an individual appointment with Dr. Bausum. But it really helps us provide comprehensive education for our patients without really charging them a hefty fee for it. Next slide, please. We're not the first one that have done this. Cleveland Clinic has done thousands of shared medical appointments, and they have done a little bit of assessment whether this works. And what they found is that the group care delivery model statistically increases quality of life, biometric outcomes, and improves overall physical and mental health. Like, there's overall improvement, really, and ultimately also costs less to deliver this type of care. Next slide, please. So this is just our volumes. We are not charging anything right now for shared medical appointments. And we really started this as to beta test whether this will work with our patient population. As you guys know, in 2020, we kind of converted from the in-person model to everything being online. But we've also found that our patients really enjoy that, being able to access education materials and, have other individuals who are in the same kind of boat as they are, and being able to discuss their disease with others online without having to leave the comfort of their home. And these are just some of the volumes that we have. Next slide, please. So what's the impact of this whole thing? What we found is that acupuncture overall improved symptomatology. It's an opportunity to mitigate staff and provider burnout as well. In terms of integrative oncology, consultations, it's really a market differentiator. It's something that not a lot of centers have. And also improves patients' treatment plan adherence. And then shared medical appointments. It's a group care delivery model that improves overall patient satisfaction. So those are really the focus areas. Next slide, please. Next slide. So what's the future holding for us? I'll give you a quick rundown. I will turn it over to Jennifer Morthland to talk a little bit more about our Winship Tower. But in terms of growth, we are starting a clinic, an integrative oncology and survivorship clinic in our Winship Clifton office. It's October 24th is our date. So we will provide a little bit more about that once we get closer to that date. We're also adding a Winship Wellness Center in our Clifton office, which is the main campus, where we'll have a new acupuncturist. So we're going to increase availability of acutherapy appointments. We're working on implementing a research component. And of course, if you guys haven't heard already, we're building our Winship Midtown Tower, which will house an integrative oncology and survivorship suite. They have a few more images of the integrative oncology suite at the Midtown Tower. If you just go to the next slide, please. These are just some renderings of what the space is going to look like. And you can just kind of click through those so that you guys can see. I'm going to turn it over to Jennifer Morthling. I think she's going to talk a little bit about philanthropy. Thank you so much.
Thank you, Almira. Thank you, Anna, so much for sharing more about Winship's program here with Integrative Oncology. We're very excited that Winship now has this program available and that our patients don't have to go outside Winship to pursue this care. As both Almira and Anna shared, there's a lot of interest and benefits for our patients in taking part in some form of integrative oncology. So we certainly want to be able to offer more of these services beyond our limited capacity at this point in time. And much of that comes in the form of philanthropic support from those in the community. As Anna mentioned, she is the only naturopathic practitioner that we currently have on staff. So there is certainly an interest to grow more service providers so that, you know, beyond Anna, there is opportunity to reach other patients in clinical programs beyond head and neck and others that they're dedicated to for the time being. Additionally, from a program perspective, I know Anna spoke to research-based evidence that shows what complementary therapies can do to help in cancer care. So there's certainly obviously opportunities to support other research efforts that look at therapies that maybe we're not currently looking at, as well as wellness programs. I know that they focused on acupuncture as a key opportunity that we're pursuing, but there is efforts and interest to look at expanded programs like art therapy, music therapy, and meditation, as they had shared earlier in the slides. And then as Almira said, there is a clinic opening here at the Clifton campus, but we are very excited that the integrative oncology space will have a dedicated center and our new Winship at Midtown Tower, where there is space for group consultation and as well as staff and healing and wellness rooms. So, you know, while we are very, very focused on patient care, we also want to make sure there is opportunities for our staff and our providers to take respite in what they're doing as well. So we are excited to have this space there. And as Almira mentioned before as well, that right now we're not charging patients for the services. And much of that has been through the generosity of our community and donors to help offset those costs. So for those interested who would like to learn about other opportunities to help grow and expand this program, we certainly welcome, community involvement. We'll turn it back to, I guess, Amanda, if there's other questions for the group.
Yes, thank you, Jennifer, and thank you, Almira and Anna. I'm going to look and see if we have any questions. I do know that one question that came ahead of the program was about insurance, and does insurance cover these services, or how are these services paid for? So please share.
I'll answer to that. These types of services are not routinely reimbursed by insurance, whether it's an integrative oncology consultation. Acupuncture is covered under insurance, or some insurance providers for certain indications. It's this uncertainty or unreliability that has left us committed to continuing to provide them free of charge right now, really as a courtesy for all established Winship patients along the continuum, new diagnoses all the way through survivorships. People do not receive a bill right now for any integrative oncology care they receive. And that's in large part thanks to some startup money where we've really have Winship support and dedication in helping grow this program and provide this type of meaningful care and support to our patients.
Thank you. And along those lines, how would a patient get set up? Do they need to be referred by their provider, or is it something they can find on their own, or how would a patient go about receiving these services?
I would direct them right now to emailing the email I provided to you, Amanda, integrativeoncology@emory.edu, and we can have a next step conversation there, get their information and either connect with their clinical care team or go ahead and have them kind of set up for initial consultation or other services. Right now, there isn't a formal way with Epic. There'll be more streamlined ways at fielding referrals through your care team. Right now, it's doctors who refer, they send me emails or messages. We receive carrier pigeons and smoke signals. It's just we're showing up in the best way we can in a system that we're still figuring out how to lay the inroads in. So we're happy to field an email.
Thanks for sharing that. And I will share that email address at the end of the presentation for anyone that needs it. So a couple questions coming in through the chat. One is, what are your thoughts on CBD and THC?
The CBD, THC, really with any product that a patient might be turning to, quality is always the biggest concern, followed by making sure that we're coordinating it well with their care. The palliative team is really, really well versed with CBD, THC, and they even help write some of those like medical waivers and helping connect patients to official inroads to receiving those products. But in general, I think it's an awesome, if done right, an awesome complement to someone's care, can provide meaningful relief of pain, nausea, mood support. But if a little is good, more isn't always better. As with everything in medicine, CBD, THC is metabolized through the same liver pathway as over 90% of your other drugs. So it's really something you should be looking at as a drug and being very upfront with your care team that you are taking, because if we see your liver enzymes creep up and that isn't part of the conversation that you're adding things into your care, then God forbid your care team is making decisions on which medicines to hold or your treatment to be delayed, because we just don't have all the information. So I'm happy to be part of the team to just really kind of leave people feeling empowered that they have people on the inside that are well versed in helping coordinate all this so that everyone's goals are met and we keep patients safe.
Thank you. Here's another one I'm going to read verbatim. Since Winship has clinical dietitians specialized in oncology nutrition, how are you ensuring patients are able to get nutrition education from these specialists? Have you considered incorporating dietitians in your Winship Wellness Center?
So
Yeah, I can answer that one.
Yeah, okay.
Okay. Yes, we absolutely have. I think it's going to be really important for us to work closely, not only with our nutritionist, but also with really all services. We're only going to be as good for our patients as we can collaborate together and really find a personalized plan that's best for the patient. So what my plan is, and I'm hoping that our nutritionists are open to this, to incorporate them in our shared medical model. So providing some of those education sessions, because certainly they're the ones that are the most well-versed within that space. So we would want to provide some education sessions for our patients as well. I know a lot of our dietitians are incorporated in our clinics right now. So having them available to our patients in some of the new clinic spaces that we're opening is going to be critical. Not to mention just referrals when we feel that there's a huge need for a specific patient with some very unique dietary needs that we are unable to handle. So collaboration, incorporating them in our education sessions, as well as our clinic space is going to be, I think, the number one focus area. Right now, we're just trying to secure space and make sure that we have all of the elements available so that we can start on this collaborative process.
And I'll add on to that. So in my consultations, I ask every patient, has someone talked to you about how you should be eating for your diagnosis or the stage of care you're receiving? And from there, refer out to appropriate nutritionists, because it really deserves to have its own dedicated conversation. It's not something that you can really robustly and confidently cover in 3 minutes. So, and it's something that I think are changes to be adopted over time. So I really want to underscore what Almira said there too. I see it as a partnership, a relationship where we're all working together for a patient, and each person kind of brings different strengths to that team and help patients achieve those goals in adopting kind of meaningful dietary changes as well as other integrative aspects of their care.
Thank you. So how do you see integrative oncology advancing in the next, short term, maybe 3 to 5 years, and then, really long term, 5 to 10 years? What do you think are some of the advances that might come up that can benefit patients?
I'll leave this one to Almira.
Yeah, I think the biggest thing is that we're kind of a decade behind, to be honest with you, like Georgia as a whole. We tend to be a little bit more on the conservative side when it comes to some of these complementary treatments. But if you look, at other states, they have had this even internationally. I know I'm originally from Europe, and like this is part of normal care. So I really think that there's going to be a shift where a lot of patients are a little bit more conscious of what they're putting in their body, and really they want to feel empowered to be able to take care of themselves in a meaningful way where they have a lot of the control rather than leaving everything up to their providers. So I really think that there's going to be a shift where patients are going to be more and more interested in these type of services, and I can only see it growing from here. And for us to be one of the few cancer centers that offer these services is going to be critical. So I think it's perfect timing for us. And I'm really excited to see not only about the growth in terms of space, but also the growth in terms of our providers that we're going to have. So I really see that there is going to be a shift in integrative care overall.
Thank you. Okay, can you please explain the difference between palliative care and integrative oncology?
Anna, you want to do this one or do you want me?
Sure. So the term palliative basically just means we're helping support symptoms. Primarily that is through medication management, if you will, of nausea, of pain, of mood. And the integrative approach is it respects the use of the pharmaceuticals that are being prescribed. My training is such that in Georgia, I'm more limited, but my training is such that I can prescribe pharmaceuticals, interpret labs, and really diagnose and treat people too. So I bring this appreciation to the table in order to add things in. It's as if you have the spokes on a wheel, and the integrative piece is helping shore up and strengthen kind of the patient at the center so that we're getting kind of more meaningful control of pain, of nausea, of other symptoms in this and together approach. So our interdisciplinary clinic is going to be a co-presence of me, of cancer rehab, of palliative, of the supportive pain service, so that people are getting the type of care they need in the unique ways or iterations that their body is saying is going to be important. One example may be being here of the difference between palliative and or integrative and where they intersect is an opioid for pain management. There are people who are either intolerant of opioids based on kind of how they are left feeling mentally and emotionally. They can cause constipation, and there's an upper limit for how much opioid someone can take in a day. This is where the integrative approach can come in and help people need less medications that have their own risks and side effects and upper limits of what we can provide, and can draw on other resources in their toolbox to help manage how they're feeling in any given point in time.
Thank you. This one's kind of a two-part question. Can non-Emory patients in the community participate in these programs? And then separately, those that are maybe a little bit further out from their cancer journey and, you know, are survivors at this point, are they able to participate in these programs? If not, what are some things that those populations can be doing to, you know, further support their cancer journey and survivorship? Sorry,
I'll answer the first
3 questions.
I'll take the first part of that question.
Sure.
So I actually came out of private practice to be here at Winship and do this type of work because if you're on the outside and don't have all your medical records and something coordinated where there are other doctors that can be part of the conversation, a full list of your medications and oversight in that way, all this other information that surrounds someone, their diagnosis and how they're doing, that's a big rate limiting step. So right now, the way we're operating is if someone is receiving care at Winship and they've had appointments with their medical oncologists, other providers, all their records are in the system, that is someone I can clinically and confidently support because I have all the pieces of the pie as well, in a way that's just harder to do if someone's coming from the outside. And what I saw was extremely difficult when I was on the outside operating in the private practice space, because between labs, medicines being updated, we're really asking a lot for a patient to be shuttling their medical records back and forth between different providers at different institutions. So right now, it's we're not operationally seeing people who aren't receiving their care at Winship right now. And I'll leave Almira to comment to kind of the survivorship piece.
Yeah, so just to kind of echo what Anna is saying, not only are we limited from a clinical perspective, but also from a programmatic perspective, we do have limited space and staff at the moment. So to open it up to, you know, other outside of Emory, I think would be really a huge limiting factor for us because our schedules are already getting full pretty quickly. So perhaps that's maybe something that we can discuss future state, but for right now, we're really living under the Winship oncology umbrella. So that's really one of the limiting factors in terms of survivorship. And sorry, I think can you guys hear me okay?
We can hear you fine, yeah.
Okay, sorry, something weird happened there. But great, in terms of survivorship, so we are seeing survivors, a patient is considered a survivor from the moment that they're diagnosed all the way throughout their life. So even if patients are, 5 years out, but are experiencing some of these side effects, we are absolutely willing to see them. And in fact, that is a huge component of our NCI designation in our Commission on Cancer work, that we do have a survivorship program. And we're absolutely willing to see those patients. So all they have to do is contact their primary provider and get they could probably contact us directly as well. So because we don't need an internal referral, but absolutely we do see survivors.
Thank you. So Jennifer touched on the philanthropy aspect. So thinking about, if money were no object and, we had all the philanthropy in the world to support this program, kind of what's your big picture that you would love to see? Do you want this in every Winship location? How many providers? Tell us what, your grand thoughts are on that.
Almira, take it away.
Yeah, so I'm like excited by that prospect, but one of the feedback points that always kind of resonates with me is that when I talked to a clinic and he told me, why can't you have one of Dr. Bausum in every single clinic? So I would love the idea to have a naturopathic physician supporting all of our clinics and being able to go in the room with their primary provider to, talk to the patient, to, in conjunction with their regular care. So have this incorporated as part of their regular care from the very beginning, and rather than having referrals, rather than trying to figure out how we're going to fit this person in, but that support from the very beginning all the way through as long as they need it, really. And yes, I would love to be able to have this at all of our locations. Right now, again, funding is a limitation, people are a limitation, space is a limitation. Even with our Acutherapy clinic, we're utilizing space that's dedicated to physical therapy. So we're really trying to get creative on how we approach this. But big picture item, I would love to have a naturopathic physician in every single space and every single disease group, at least one. And then continue to offer our acupuncture services for free. In addition to that, offer other therapies such as art therapy, music therapy, massage therapy, and things like that, and on a regular basis. So ideally, if we could do that, that would be amazing. So, but we're working towards it.
Thank you. We're just about out of time, but I'd invite Anna, if you have any final thoughts, and then I'll close us out.
I just want to thank everyone for tuning in today, asking these thoughtful questions. And I really want to express my deep gratitude. It is not only really meaningful work, but I truly feel very humbled and thankful to be able to show up for patients at all stages of their cancer care through survivorship, to help bring an element of education, empowerment, and engagement that is just kind of the next frontier in revolutionizing how well people tolerate their treatment, recover from their treatments, and live after a cancer diagnosis.
Yes, to echo Anna, I'm absolutely grateful to be here and to be able to provide services like this to our patients. This is really important. And I feel like we've been talking about this for years since I joined Emory, and to now finally seeing it realized, it's really incredible. It's only, we're only able to do this because we've had such incredible support, not only from our providers and staff, but also from Winship leadership. And we're excited to continue to be able to grow this program. So again, thank you guys so much.
Thank you all so much again to Dr. Bausum and Almira. Let's see, I am sharing the very end of the program, very beginning. I'm going to pull up those emails that were shared with us. If you'll give me just a moment. I want to make sure I'm sharing the right thing with you.
We're happy to field more questions on that email address provided, as well as any potential referrals or interest in connecting patients, either survivors or people who are currently receiving care here at Winship.
Thank you so much. So here's that email address that Dr. Bausum shared earlier. If you have any questions for her or Almira, and then also Jennifer's contact information here if you have any questions about those philanthropic community opportunities. I want to thank everybody again for attending, and we hope you have a wonderful rest of your day. Thank you.
Thank you.